Welcome back. Today we are talking about pain. Whether you are feeling it anywhere from head to toe, Southern Pain and Neurological can help you out. This morning we are joined by Dr. Paul Hubbell III. He is here to tell us more about the wide range of services they offer. Good morning, doctor.
Hello, how you doing today?
Doing good. Thanks so much for joining us this morning. Now, for those watching out there, Dr. Hubbell is an interventional pain specialist. For those who do not know what an interventional pain specialist is, what is it, and what does interventional pain management look like?
Yes, that's a kind of a common misconception for people. They believe that a pain management doctor is one who prescribes medications or opioids as a treatment, and that's the only treatment that's available. An interventional pain specialist is a physician who has extra education and training in procedures that can diagnose the cause of pain, help understand the patient's pain, and deliver treatments that allow improved quality of life. There's a new technology that helps to allow patients to become increasingly active and get back to normal life in today's world.
Which I think is great because we all want to get back to normal for sure. Now, let's talk a little bit more about pain because when I think of treating pain, oftentimes I think of medications, injections, but not all pain conditions have to go down that route. Is there an example you can give us of a treatment maybe you all provide that doesn't necessarily deal with those really traditional measures?
Sure. There's patients who have had, let's say, surgery or an auto accident or work injury and have developed a nerve pain, and it may radiate down their arm or their leg, through their back or their trunk, up the back of their head. There's medications, there's injections, there's alternative treatments, but chiropractic, physical therapy. But when these don't provide long-term relief, there's an outpatient innovative procedure called spinal cord stimulation that allows an exceptionally high success rate and a significant return to quality of life with minimal surgery. It's an outpatient procedure, and you're back to normal in a week or two at the most.
There you go. So it also helps out with recovery, which I think is great. I want to ask you about a few more conditions I know you all deal with at Southern Pain and Neurological. What about sacroiliitis? What is that, and how do you all treat that condition?
That's an inflammation of the sacroiliac joint, which is that's at the base of your spine and your lower back. 25% of people with low back pain think they have pain caused by a nerve, but it's actually in a joint. The joint becomes inflamed and swollen. So we can usually provide medication, provide physical therapy, chiropractic, inject the joint with steroids. If we get improvement that's short-term, not long-term, we can provide a very interesting procedure which can deliver relief of that joint pain by placing a piece of demineralized bone in that joint and cause that pain to be gone within a week.
Very interesting. What about stenosis? For those people who do not know about stenosis, what is that and how do you all treat it at Southern Pain and Neurological?
Well, with stenosis, that's when a patient starts, you'll notice usually elderly people start walking using a grocery cart, a walker, a cane. They're bending forward and they can't straighten up because that causes pain and tightness down the leg or in the back. So there's a device we can place in the back that's through a half an inch incision that actually keeps the vertebra separated and keeps a patient able to walk upright, and now they can walk unlimited distance. This device looks like this, and when it's opened, it's placed in, it's like a molly boat, if you will. It fits right between the spines. It's just a little bit below the skin, and it just takes about 10 to 15 minutes to place.
Fascinating. Now, I know you have worked with many different patients at Southern Pain and Neurological. What type of feedback have you gotten as a doctor from the patients that you work with?
The patients are thrilled to find something that's less than open surgery that allows them to return to their normal lifestyle.
I think that is great. Now, doctor, we have a little bit of time left, and if possible, I would love to hear more about your story because you were a dentist that then changed into this profession. Tell us a little bit about that because it's a great story.
Yes, I was injured in an auto accident while I practiced dentistry, and it caused me to have a couple of herniated discs and a fractured vertebra, which didn't allow me to sit, lean forward, and twist for 8 hours a day providing dentistry. So I became an anesthesiologist as a dentist at Boston University. Then I became a clinical instructor of anesthesiology at Boston University. After that, I went to medical school. And following medical school, I did a residency in anesthesia and interventional pain at Mayo Clinic so that I could help people to return to normal lifestyle and treat their pain. The types of treatments we have now weren't available when I was injured. So it's very rewarding to be able to offer a solution to patients who have the similar pain or worse today.
It really is a great story. You took something tragic and then you turned it into your purpose, and now you're helping out a lot more people who have these different conditions. Doctor, thank you so much for joining us this morning. And hey, to learn more about Southern Pain and Neurological, you can log on to southernpainclinic.com or give them a call at 504-226 5576. And as you can see, they have two locations, one in Metairie on West Esplanade Avenue and one in Covington on Pinnacle Parkway. All right, my friends, stay tuned. We'll be back with more Great Day Louisiana in just a few minutes.